In this tutorial, we'll teach about the therapy for keratosis pilaris. We hope you find the information helpful. Well, let's learn more about therapeutic options for keratosis pilaris. Well, as we discussed in a previous video, KP is a genetic condition. It has associated follicular-based plugging, so little bumps often happen along the triceps, the cheeks, the thighs, sometimes the buttocks, and usually there's background redness. And people with KP tend to have sensitive skin. So what are we going to do about it? Well, the first step of KP treatment is simply to control dry skin. And so when it's not a cosmetic issue, just using mild soaps and what we call bland emollients is all that needs to be done. So some mild soaps such as Cetaphil or CeraVe, Dove Unscented Body Wash, these are all good options. And a hypoallergenic cream, Vanicream, CeraVe, Cetaphil are nice options. If you're having a lot of redness, simply using 1% hydrocortisone can be beneficial to the region. And if your child or if you have very sensitive allergic type skin, what we call atopic dermatitis, well, it may be helpful for you to watch our atopic dermatitis video to learn about treatment options. So step 2, if KP has become a cosmetic issue, and it tends to get worse during the preteen and teenage years, you may want to start exfoliating these follicular-based keratotic plugged pores. So what do? Well, there are several different over-the-counter and prescription products available. The ingredients you're looking for are urea, salicylic acid, alpha hydroxy acids, in particular one known as ammonium lactate, or retinoids. Salicylic acid, this is often found in acne lotions and washes. Alpha hydroxy acids, there are several out there over the counter. The ammonium lactate is in the class of alpha hydroxy acids, and then glycolic acids also fall under this heading. There is one that's often found in dermatologist's office called a KP kit by Glytone, ammonium lactate. Some brand names are Lachydrin, Amlactin, Lacticare. These are all nice options that can be found over the counter. Again, there's urea and retinoids are another option that can help exfoliate. Well, if you're exfoliating the area, you have to be careful because people with KP tend to have sensitive skin. If you overdo it, it's going to cause some redness and irritation. Then if you try and apply the exfoliating lotion, it's probably going to sting and burn on that raw skin. So we want to balance how aggressive we get with the exfoliating. So step 3, well, control the redness and irritation. So let's say you have very sensitive skin. You want to decrease the frequency of exfoliation. And if you're having irritation or stinging and burning or itching, you want to start using a bland emollient like CeraVe or Cetaphil, or you can also use 1% hydrocortisone. If your skin is very raw, then more of an ointment base may be appropriate. Something like white petrolatum, petroleum jelly, or Aquaphor, or a hydrocortisone ointment instead of a cream. If you're having more severe dryness, sometimes a mid-potency cortisone can be prescribed by your doctor. And of course, you want to hold the exfoliating step until the irritation resolves. If you have a great deal of redness in the area, sometimes we'll use a laser to destroy the vessels that are causing the redness. Now, this is a relatively temporary thing, as we can't reverse your genetic tendency to have redness in this area. So bringing it all together. Well, when KP is not a cosmetic issue, simply moisturize. Step 2, if you're having lots of follicular-based plugs and you want to exfoliate, you want to use a buff puff. A little technique we like to recommend is that you keep the exfoliating lotion in the shower, and after your shower, you take your buff puff, you put the exfoliating lotion on this polyester sponge and use the sponge to apply the lotion. That will help exfoliate and also help the medicine penetrate into your skin. You want to do this daily for maybe a week, and then after that you can use it once or twice a week for maintenance. If you're getting too much irritation, you want to keep the balance. Back off on the frequency, maybe use a little 1% hydrocortisone until any irritation or redness resolves.